Time now to speak to the government. Joining me this morning is the Health Minister Stephen Kinnock. A very good morning to you. Thanks so much for joining us today.
Morning.
Today you're announcing that the NHS is going to begin vaccinating babies against chickenpox. So tell us about that rollout and why you've decided to push ahead with it.
Yeah, we're really pleased to announce today that from the 1st of January 2026, the chickenpox vaccine will be available on the NHS, and it will be rolled in with the measles, mumps and rubella. So it will become the MMRV vaccine. It's going to be a jab at 12 months and 18 months. We think that it's really important we do this both for the health benefits, because chickenpox can, often it's just in a mild form, it doesn't really cause huge issues from a health point of view, but it does have the potential to cause quite serious health complications, and also particularly for people who get it when they're adults. And we also see strong economic and educational benefits. From an economic point of view, so many parents will know that they have to scramble for childcare, take days off, and that's not good for them, not good for the economy, not good for their places of work, and of course for on the educational side of things, it's great that kids will be able to spend more time in their settings, whether it's nurseries or schools or whatever it might be. So it's a win-win, we think, for parents, for the economy, and for kids. And we're really pleased that it's going to be rolled out from the 1st of January 2026.
And as you say, you're rolling it out in conjunction with the MMR vaccine, but the uptake of that combined jab is at its lowest level for 15 years. So how are you going to persuade parents to get their children jabbed?
Yeah, we're doing a mixture of local and national campaigns. So we've identified areas of the country where uptake is particularly low, and we're doing concentrated and targeted campaigns there, working with GPs, working with public health authorities, working with schools to get the message out about the benefits of getting vaccinated. And then there's also national campaigns, and we're going to be rolling out more of those campaigns and really being proactive about the way we inform. Unfortunately, there has been about a 10-year steady decline in vaccine take-up. And of course, that was not helped by the vaccine hesitancy that we've seen after the pandemic in some communities in particular. So it's a mixture of these targeted approaches and campaigns and national campaigns too.
Well, yes, and you talk about the vaccine hesitancy since COVID. Is that what you put it down to? How do you explain why the numbers of people getting their children vaccinated appears to be going down?
Yeah, I think unfortunately we do have out there quite a lot of misinformation and disinformation. Vaccines seem to have become a target for certain conspiracy theorists who are pumping out on social media disinformation, unhelpful and misleading information. So I think that has been a factor. And since the pandemic, I'm afraid that has to some extent ramped up. So we are combating that. We are very pleased that we're seeing in the latest figures, which I think were published very recently, showing that that number is stabilizing. So it appears that we're stopping the decline, but we are not yet getting it back up to the levels that we want to see it at around the 95% level.
Yeah.
And that is a job of work we're looking at very closely as part of our 10-year plan.
Well, yes, and it has meant that almost 1 in 5 children are expected to start primary school this term without full protection against serious illness. How worried are you about that?
It is a worry. It absolutely is a worry. And if you look at the big shifts in our 10-year plan from hospital to community, from analog to digital, and that third really big shift is from sickness to prevention. We're really clear that prevention is always better than cure. It's better in terms of patient outcomes. It's also much better in terms of value for the taxpayer. And so we're really, really keen that we work with communities, we get the message out there, this combination of national and local campaigns, getting people caught up on the vaccines when they don't have them, working closely with with GPs. There's a whole range. There isn't one sort of silver bullet that's going to solve this problem. It's a whole range of initiatives and interventions that we're going to deliver. But you're right, it is a concern and is one that has to be urgently addressed.
And with this shifting of focus for the NHS on, with more emphasis on prevention, are we going to see more future vaccination programmes being rolled out, do you think?
Well, we certainly keep that under review, and obviously, with all of these things, there's got to be a balance around the budget that we have and the other pressures that there are on the Department of Health and Social Care. But there's no doubt at all that the value for money of prevention, the investing in prevention in terms of what it saves further down the line, that case is absolutely clear and compelling. And that's why we're always looking at opportunities to improve prevention, and vaccines are a vitally important part of that process.
I want to ask you about the decision today by the Court of Appeal over whether or not asylum seekers will be asked to leave the Bell Hotel in Epping. If that judgment doesn't go the government's way and the asylum seekers do have to leave, where will they go?
Well, we're really clear that we want every asylum hotel in the country to close down, including the Bell Hotel in Epping.
But you're fighting to keep this one open.
Yeah, because it's not a question of if we close the hotels, it's a question of when and how we close the hotels. And what we don't want to have is a disorderly discharge from every hotel in the country, which would actually have far worse consequences than what we currently have in terms of the impact that would have on asylum seekers potentially living destitute in the streets. And I don't think any one of the communities that are campaigning on this hotels issue want to see that. So what we are doing is looking to appeal this injunction simply because we're taking a pragmatic approach to how we want to manage the process, not because we believe that the hotel per se should stay open.
Yes, but what if you lose? Where will those migrants go? I mean, this has been, on the cards for days now. There must be an answer because I think it's 12th of September that they would have to move out by. So where will those migrants go?
Yeah, we've got a whole range of options, disused warehouses, disused office blocks, disused military barracks. We are looking at every option that we have to manage the discharge. And it's really important that we do that and put those plans in place. But of course, it's going to be much more effective if we're able to do that in a way where we're controlling the discharge from these hotels. I would simply say that I am as frustrated as every person in the country about the use of these hotels for asylum seekers. That is not what they are there for. We inherited a complete and utter mess from the previous government that had lost control of our asylum system. We're looking to clear up that mess. We are committed to getting every asylum seeker out of these hotels. I share people's frustration on that. What I would simply say is it's important that the government is able to do this in a controlled and managed way.
And the Home Office argument during this case seems to be that the rights of migrants outweighs the rights of protesters. How do you think the public will view that?
The views of local communities and of the public are absolutely paramount. And that is why we are committed to closing down all of these hotels. We simply want to do it in a way that is managed and controlled. That is why we are appealing this decision today. And I am here as a government minister reiterating the point that it is a matter of government policy that we will be closing down all of these hotels. We just need to do it in a managed and controlled manner.
OK, well, Stephen Kinnock, we appreciate your time this morning. Thank you very much indeed for joining us. Thanks.